I will start with the introduction. Kidney failure is a condition where our kidneys is totally loose from their ability to remove waste and fluids from our blood in our body. For your information, when we have a chronic kidney disease, it will not affect only one of our kidneys, but it will affect both of our kidneys at the same time. It is because our kidneys work together to cleanse our body and to do another function. Next, when our kidneys are filled, it means no backup to filter the waste and fluid from our body. Next, kidney is an important organ in our body because kidney has a major function such as to remove waste products and to remove excess fluid. The waste product and the excess fluid will be removed through the urine. This process is necessary in our body to maintain a stable balance of body chemicals, balance the body's fluid, and also to release hormones that regulate blood pressure. Next, problem statement of kidney failure disease. This kidney failure will give affect the human health such as high blood pressure, anemia, blood vessel and also neutropenia. This kidney failure disease happens slowly because it has 5 stages before it becomes chronic, started with acute kidney failure. This kidney failure can result and repeat if this disease untreated because patient body feels tired and fills with extra water and waste products and it's not good for our body. Next, the objective why we do this survey. The objective why we made this survey is need more attention about this disease among people, to reduce the number of kidney patients, to provide awareness to the people about early prevention of kidney failure disease, because this disease is not only occurs in the elderly but can also occur at a young age. And the last one is to see the level of healthy lifestyle among people to prevent kidney disease.
My name is Alicia Nur Nadia Akira binti Abdurrahman, and I am going to continue with the methodology used throughout this project. We have conducted a survey that involving respondents consisting of people with kidney failure at Dialysis Central Network Clinic that located at Pekandan Selangor, the elderly aged 40 years old and above, as well as the general public to find out more information about the percentage of people with kidney disease in Malaysia, the possible causes of this disease, and how they deal with it. The survey has taken place on a platform that is easy to access by all ages, named as Google Form, through link which is distributed at WhatsApp, Instagrams, and any other social media. The other option is in paper form for surveys that involve face-to-face interview with patients at the Dialysis Central Network Clinic located at Pekandan Kil. Other than that, there are some questions that have been asked during the interview process conducted with the patient as well as those same listed in the Google form distributed. Among the questions given are as follows. First, what are the symptoms they felt before being diagnosed for kidney failure? Second, what are the causes of their kidney failure and did they have any verification from the doctor saying they have kidney disease? Third, the way they deal with kidney failure as well as opinion on appropriate treatment for those with the disease. The last one is the method of treatment they prefer, either go through hospital or traditional, and further information such as the type of treatment given according to the method they choose, how long it takes to complete the treatment process, and whether the treatment requires a lot of money or not. Through this survey as well, we have asked questions about at what age that they were first diagnosed with the kidney failure. Due to the pandemic situation and clinical procedures that protect patient data as private and confidential, we are not allowed to take a picture of the patient who went through the interview session. So, we provided the images of conversation between us and the nurse, as well as the other proof available. Here are some proof and images that we are able to obtain during this survey. First one is the image of the conversation with the nurse at the Dialysis Network Clinic in Pekandan Kil. The second one is the My Sejahtera scan at the clinic and the clinic photos.
based on our data that has been collected, the respondent gender pie chart shows that patients that have kidney failure are higher in female than male. The percentage shows that 61.3% for women and 38.7% for men with kidney problems. One of the reasons why females are more easily have kidney failure is because women have short urinary tract compared to men. Furthermore, the respondent status pie chart shows that people who already married have a higher percentage compared to a single person. From 31 respondents who suffered from kidney failure, 78.1% of them were married and 21.9% were still single. This pie chart shows that the percentage at which age the respondents was detected to have kidney failure problems. The data shows that the highest percentage is at the age 50 years old and above, with the percentage 37.5%. Further, the percentage for the age range 18 years old to 30 years old and 30 years old to 50 years old are the same, with the respective percentage being is 28.1%, and the age range with the lowest percentage being is 18 years old and below, with the percentage 6.3%. Next, as to treatment methods. Most of the respondents prefer to seek hospital treatment as opposed to traditional treatments. A total of 3.9% of the respondents choose to seek treatment in a hospital and 3.2% to seek traditional treatment. Further, the percentage of those who choose both treatment 12.9%.
So these tables are the tables of data that have been collected through our survey from our kidney patients. So there are 4 tables. So we go to the first table, which is the symptoms of kidney failure. Okay, so the symptoms are back pain, breathing difficulty, nausea, swelling of body part, change in urination, and others. So for the others, we had collected for our patient is tiredness, loss of weight drastically, pain in the eye, and pain in the heart. So as you can see that change in urination is the most common symptoms in kidney failure. Example of change in urination is where the color of the patient pee will change to dark color such as brown or red. This is because this pee may contain blood. Next, we move to the causes of kidney failures. Causes are the blockage such as kidney stone, autoimmune disease, urinary tract problem, illegal drug use and drug abuse, not enough blood flowing to the kidneys, genetic disease, and others. For others, the causes that we have collected from our patient is taking supplements, drinking 3-in-1 sachets every day, dissent from the family, overdose pill intake, and mistake in taking wrong pills from the doctors. So in this table, we can see that the highest number of chosen causes is the urinary tract problem. So urinary tract problem is when the failure or there is an infection caused in our urinary system. So our urinary tract contain kidney, ureter, bladder, and urethra. So in this infection, we can clearly explain that there is bacteria in our urine that may cause infection through the urinary tract. Okay, next we move to the prevention tables. Follow a low salt, low fat diet. Second, exercise at least 30 minutes on most days of the week. Have regular checkup with your doctor. Do not smoke or use tobacco, limit in taking alcohol, and others. So others prevention that our patient state is stop instant food intake and traditional medicine. So the common prevention that has been taken by our patient is regular checkup with the doctor. So this is the correct ways and correct prevention for the patient to prevent any disease, as we cannot assume that the smallest pain that we had will not lead to the very harmful and the dangerous disease. So it is better to have a regular checkup with the doctor. So lastly, for the treatment tables, there's two treatment that have been asked to the patient, which is taking antibiotics for pyelonephritis and transfusion for blood. For the others, treatment by the patient is the treatment of dialysis. Dialysis is the process of removing excess water and excess toxins from the blood. So dialysis is an artificial kidney that filtered excess fluid and blood from our body, and the filtered blood is transferred back to the body of a patient. So for the transfusion for blood, a blood transfusion is a routine medical procedure which donated blood is provided to the patient through a narrow tube placed within a vein in the patient arm. So this transfusion for blood is the treatment where it removes toxic blood from the patient with donated blood that is more clear.
My name is Nur Amira Izzati binti Saim, and I will explain about the discussion for this study. Based on the survey, the graph showed that 61.3% are women and 38.7% are men. Women are likely to have a chronic kidney disease than men, but men tend to reach kidney failure sooner than women. This may be happen due to higher testosterone level in men than women. Testosterone is a sex hormone that regulates fertility, muscle size, and blood cell synthesis. However, high level of this hormone can increase the blood pressure and develop blood clot that can contribute to kidney disease. Next, most of the respondents had a symptom of changes in their urine. This is due to the inability of their kidney to filter waste properly from the body and can't regulate the balance of water and salt in their body anymore. Swelling at some of their body part is also one of the symptoms that they had. When our kidney fail to function, there will be an increase of sodium retention due to the kidney that can remove extra fluid from our body. Normally, the swelling is at their feet or their ankle. Kidney failure also will make them lose their appetite. This is because the blood will build compound that can affect their sense of taste. Other than that, few of them were also having a back pain and difficulty of breathing because there were a blood clot that formed in their vein of their kidney. There are some causes that can lead to kidney failure. From the graph, most of them were having a history of high blood pressure and diabetes. High blood pressure or hypertension happen when the force of blood push against the blood vessel wall. When the blood pressure is higher than normal, which is 120/80 mmHg, it will destroy the blood vessel, including ones in their kidney. Diabetes occur when their body doesn't make enough insulin. Insulin is a hormone that regulates our blood sugar level. When the blood sugar level is high, it can lead to many problems, including our kidney. Next, overdose pain medications such as aspirin, naproxen, and ibuprofen can also harm our kidney because these are mainly abuse waste that are excreted throughout our kidney. We also found a respondent that have a genetic disease called as polycystic kidney disease. This disease can be inherited where a cluster of cysts will develop primarily within their kidney. Hence, there will be an enlargement of their kidney and it will lose its function gradually. These cysts can grow larger, and when there are a lot of big cysts, it can harm their kidney. Finally, few of them also get a kidney failure because of overconsumption of caffeine in 3-in-1 coffee. Caffeine can make a sudden increase in their blood pressure. From the graph also, it showed that the highest percentage is 37.5% from age 50 years old and above. We can say that kidney failure is very common for people in the age. As we and our kidney increase in age, we lose some of the nephron and some of it might not work efficiently than when we are younger. When we lose some of the nephron, it will affect the estimated glomerular filtration rate, which is a blood test that indicates our level of kidney function. There are a few ways on how to prevent kidney failure. Firstly, frequently have a health medical checkup with a doctor. This way can help us to monitor and always alert with our health condition. Secondly, avoid smoking and limit the alcohol intake or never involve in these two. Smoking and overconsumption of alcohol can increase the blood pressure and their kidney also need to work harder. Thirdly, do exercise often, at least 15 minutes every day, and eat low-salt food. Exercise can enhance our number of metabolic factors such as blood pressure and the insulin resistance. This can preserve the renal function and lower the risk of kidney failure. Meanwhile, eat a low salt can prevent excess sodium intake in our body that can lead to hypertension. From the study, most of them prefer to get a treatment from the hospital such as dialysis 4 hours 3 times per week than any oral remedy because they think that it is safer and more convincing. Express, kidney is an organ that plays an important role to remove waste and extra fluid from our body. Both men and women must take a precaution regarding their kidney by practicing a healthy lifestyle. There's a few treatments that we can do once we have a kidney failure, such as dialysis and kidney transplant. However, prevention is better than cure. Here is all the references that we use.